So, hello students. We'll start. Able to see the chat. Okay, fine. That's fine now. So, hello students. Hello to all of you. I'm able to see the chat. Okay. Chalo, the topic of neuroanatomy today, right? Some important topics that we'll discuss of neuroanatomy, which are important. The first topic which is asked is the surfaces of the brain. Like, describe the supralateral surface of the brain, the sulci gyri, the functional areas, right, students? This is a very favorite question across all the universities. So let us just go through this. Supralateral surface of the brain. Yes, this is how the brain looks on the supralateral surface. What is this sulcus here? Lateral sulcus. What is this sulcus here? Central sulcus, right? Central sulcus, lateral sulcus. That's a precentral sulcus. That's a postcentral sulcus. That's a frontal lobe. This is the superior and inferior frontal sulci. That's a temporal lobe. This is the superior and inferior temporal sulcus. That's a parietal and occipital lobe. This is the parieto-occipital sulcus. And what is this sulcus? Calcarine sulcus. Calcarine sulcus. Clear? Hi, good evening. Good evening to all of you. So these are the various sulci that you have to draw on the supralateral surface. You have to write about the sulci. Then you have to write about the gyrus. What is this gyrus? That's a precentral gyrus. That's a postcentral gyrus. That's a superior, middle and inferior frontal gyrus. Superior, middle and inferior temporal gyrus. Right? So these are the, then this is what is expected. Now, who has classified these areas? Brodmann. And Brodmann has divided these areas into two main types. One is the primary area and the second one is known as an association area. Now, what is the function of a primary area? What are sensations that are coming to the brain? They first come to which area? Primary area. So, what is the function of primary area? To receive the sensations, perception of sensations. Which are the other areas? Association areas. And association areas will help us to understand the type of sensations. To help us to understand is to interpretation. So, functional areas broadly divided into primary area, association area. Primary area ka function is perception of sensations. Association area ka function is interpretation of sensations. Perfect. Now, what is this? We'll start with this area number 312. So 312 is the primary sensory area, right? This 312 receives all the crude and fine sensations. You have to know the tracts which carry the crude sensations, that is the spinothalamic tract, anterior and lateral. You have to know the tracts which carry fine sensations, that's the fasciculus, gracilis and cuneatus, or the tract of Gall and Porta. So that all you have to know. Now this is 312 is what? Primary sensory area. What is this? 5 and 7? 5 and 7 are known as the sensory association areas. Like this areas will help us to understand whether the type of sensations. Okay. Now coming to this occipital lobe. Occipital lobe contains which areas? Visual areas. What is this? Area number 17. That's the primary visual area. 18 and 19 are known as visual association areas, right? 17 is primary visual, 18, 19 is visual association areas. What is the function of 17? Area number 17, like a person is sitting, a person is looking, the person is able to see. Person is able to see. So which area is intact? 17. The person is able to understand what the person is looking at. That's the function of 18 and 19. So 18 and 19 are visual association areas. If 17 is damaged, what will happen? The person will be blind. 17 damaged, person is blind. That is what we call as cortical blindness. Now, 18 and 19 damaged, what happens? The person is looking, but the person is not able to understand what the person is looking at. And this is what we call as visual agnosia. Agnosia, or it is known as word blindness. Word blindness. But the words are there, but the person is not able to understand those words. Clear? So 17 is primary visual, 18, 19 are visual association areas. Agar ye damage hota hai, the person is not able to understand what the person is looking at. Visual agnosia or word blindness. Fine. Now coming to this areas number 41, 42. Temporal lobe contains auditory areas. 41, 42 is primary auditory area. Primary auditory, whatever we are hearing, we are able to hear because of this primary auditory area. Now there's an area which is located in the superior temporal gyrus. This area is known as the sensory speech area, or this is what we call as the Wernicke's area. Wernicke's area. What is the function of this Wernicke's area, sensory speech area? It helps us to understand what we are listening to. Like a person is listening to a lecture, he's able to hear. So which area is that? 41, 42. The person is able to understand what the person is listening to. So which area is that? 22. If 22 is damaged, damage to 22 leads to what? Auditory agnosia. That is known as auditory agnosia. Just a visual agnosia. So this is auditory agnosia, or this is what we call as word blindness. Word blindness. This is also known as sensory aphasia. Sensory aphasia, right? Now, a person is listening, that means 41, 42 is intact. Person is able to understand, that means 22 is intact. Now, when a person has listened to, when a person has understood, now what? The person wants to talk, right? And which is the area which helps a person to talk? That's area number 44, 45. And this 44, 45 is, yes, very good, very good. This 44, 45 is located in the inferior frontal gyrus. Just remember, that's a very important MCQ. This is a PG NEET MCQ also. Okay, 44, 45 is known as Broca's area. It is also known as motor speech area, right? So, इसमें ना बहुत clinical MCQs आते हैं. Lot of clinical MCQs. Like a person comes to OPD and the doctor is asking him, the neurologist is asking him his name, and the person talks something very irrelevant to the question which is asked. So where is the defect? So the defect is area number 22, because the person is not able to understand what the other person is asking. And there's another question. A person comes to an OPD, the neurologist is asking him his name, and the person is not able to talk. You know, the person doesn't get words to talk. The person is very frustrated because he wants to talk, but he's not able to convey it. So there's a frustration seen on his face. Which area is involved? That's area number 44, 45. So damage to area number 44, 45 leads to what is known as motor aphasia. Motor aphasia. So what is sensory aphasia? What is motor aphasia? You have to know. And bachon, look, there is something which connects this sensory, the sensory speech area and motor speech area. Can anyone tell me what is this? This is an association fiber. You know what are association fibers? They connect different areas in the same hemisphere. Association fiber connect different areas in the same hemisphere. This is an association fiber which connects the Broca's and the Wernicke's areas. Can anyone tell me the name of this? Yes, bachon, the name of this association fiber, this is what we call as uncinate. This is a very important MCQ, uncinate or arcuate. Yes, very good, Shivkumar. Arcuate fasciculus. See, fasciculus is a tract. Lemniscus is a tract, right? So what is arcuate fasciculus? It connects the Wernicke's and the Broca's area. It is also known as uncinate fasciculus. Just remember this. Very good, very good, very good, Swam. Very good, Krish. Hi, Krish Patel. Hi. Now we're coming to this, the frontal lobe. Now frontal lobe is a motor lobe, and this frontal lobe will have all motor areas, right? So what is area number 4? Area number 4 is primary motor area. Primary motor area, and this area number 4 will give rise to two types of fibers. one which begins from area number 4 and they pass through the midbrain pons medulla. They enter the spinal cord, they cross in the spinal cord, and they relay on the anterior horn cell of the spinal cord. And what is this fiber that we are talking about? The corticospinal fibers. Corticospinal fibers. This another fiber which begins from area number 4, and this fiber is going to end in the midbrain pons and medulla. So what lies in the brainstem? The nuclei of all the cranial nerves, right? The nuclei of all the cranial nerves except 1 and 2, the first and second nerves, they don't lie. Otherwise, 3 to 12, those cranial nerve nuclei, they line the brainstem. So this tracks would begin from area number 4 and they would end on the nuclei of cranial nerves. This is what we call as corticonuclear fibers. Corticonuclear fibers and corticospinal tracts. Corticospinal tracts are pyramidal tracts. Yes. Yes, Paridhi. Paridhi, yes. Now, this is area number 6 and 8. 6 and 8 are known as premotor areas. Matlab, area number 4 ka function is what? It will initiate the movement. It begins the movement. And who's actually going to carry out the movement? 6 and 8. So 6 and 8 are known as the premotor areas. Premotor areas. Okay, they are going to carry out the movement. And then we have got this 9, 10, 11 and 12 is on the medial side. Andar ki side pe, medial side pe. This is what, yes, 8 is known as frontal eye field. Yes, this is what we call as the prefrontal areas. This is what we call as the prefrontal areas. Yes, Shivkumar, very good. Clear to all of you? So 9, 10, 11, 12 are known as prefrontal areas. And what is the function of this area? Intelligence, memory, ego, self-respect. In short, social behavior. And these areas are highly developed in us. We are therefore known as social animals. Perfect. Just remember this, functional areas, and you have to discuss some pathways iske saath. So just remember this comes as an LAQ. Describe the supralateral surface of the brain under the following heads. Number 1, sulci gyri. Number 2, functional areas. Number 3 is the blood supply. Okay. Fine, bacho. Now you tell me, just look at this slide and tell me, what is the artery which lies in, see, okay, एक medial surface है, एक supralateral surface है, बराबर बच्चों? So you tell me, what is the artery which lies in the lateral sulcus? Answer this. That's a very important MCQ for you. The artery lying in the lateral sulcus. Come on, bachcho. Anyone? What is the artery which lies in the lateral sulcus? And ये corpus callosum है. There's a sulcus above the corpus callosum. What do you call this sulcus as? Callosal sulcus. Callosal sulcus. And there's an artery which lies in the callosal sulcus. Answer this. Yes, very good, Surgeon. The artery which lies in the lateral sulcus is the middle cerebral artery. Very good. And the artery which lies in the callosal, middle meningeal nahi bacha, Soham, middle meningeal nahi. Middle meningeal comes through which foramen? Foramen spinosum. And then it lies between the brain and the skull. Again, a damage to this middle meningeal artery leads to an extradural hemorrhage. Extradural hemorrhage. Okay. So this is, and ye jo arteries hai, if this arteries bleed, it would lead to extradural is subdural. Then subarachnoid hemorrhage. This is subarachnoid hemorrhage. Very dangerous. Okay. So artery which lies, artery which lies in the lateral sulcus is middle cerebral artery. Yes, Manish. And the artery which lies in the callosal sulcus is anterior cerebral artery. ये बहुत important MCQs है बच्चों. So artery lying in the lateral sulcus, middle cerebral artery. Artery lying in the callosal sulcus is anterior cerebral artery. Now, this anterior cerebral artery would supply the entire medial surface of the brain. It would supply a major part of the medial surface. It would also go to that side. If we go on that side, meaning where do we go? We go on the supralateral side. A small area on the lateral side is supplied by which artery? Anterior cerebral artery. Okay, now, the major part of supralateral surface is supplied by whom? Middle cerebral artery. The middle cerebral artery. Okay. The middle cerebral artery also supplies a small area on the medial surface of the temporal lobe. Clear? And the occipital lobe is supplied by whom, bacha? Occipital lobe is supplied by the posterior cerebral artery. Occipital lobe is supplied by posterior cerebral artery. Just remember this. This diagram you have to draw and label this. So supralateral surface of the brain blood supply आता है, तो this is the slide that you have to draw. The major part of the supralateral surface is supplied by middle cerebral artery. A small strip on the supralateral surface is supplied by anterior cerebral artery, and the visual cortex is supplied by posterior cerebral artery. Perfect hai? Now tell me, bacha, if MCQ comes, blood supply of motor or sensory area. Can anyone answer this MCQ? Blood supply of motor or sensory area. Answer this. Answer this, बच्चों. MCQ आता है, blood supply of the motor or sensory area. What do you say? Middle cerebral artery. Yes. Anyone else? What would the answer be, बच्चा? देखो, ये ना, this is so fine. Okay, ये देखो, what is this sulcus? Central sulcus. ये pre-central sulcus है, ये post-central sulcus है. That's a motor area. That's a sensory area. बराबर? Now, this much part is supplied by whom? This much part is supplied by middle cerebral artery. Yes, Dipesh, very good. And this part would be supplied by whom? Anterior cerebral artery. So, blood supply of motor or sensory area, there are two arteries, bacho. One is the middle cerebral and anterior cerebral artery. Middle as well as anterior cerebral artery. Perfect hai? And blood supply of the visual cortex or the occipital lobe. बोल सकते हो, blood supply of the visual cortex. One thing comes to our mind, visual cortex is supplied by whom? Posterior cerebral. Okay, so बच्चे क्या लिखते हैं? Posterior cerebral artery. But understand this, when a visual cortex में there's an area of fine vision. What is that area for fine vision known as? Macula. So this macula, which is an area of fine vision located in the occipital lobe in the visual cortex, is supplied by middle cerebral artery. So blood supply of visual cortex is posterior cerebral artery plus the middle cerebral artery, which supplies the macula. Very good, Aksh. Middle cerebral artery supplies the macula. Macula is an area of very fine vision. So, if there's a thrombosis of posterior cerebral artery, it leads to blindness with macular sparing. Macula spare hota hai. Why? Because macula is supplied by middle cerebral artery. ठीक है बच्चों? ठीक है, perfect. Right, very good. Just remember this now. बाकी है ना, branches of internal carotid, branches of vertebral basilar, just go through it. Now you tell me, what am I drawing for you? This is the internal carotid artery. That's the internal carotid artery which gives two terminal branches. This is a smaller branch. It is known as the anterior cerebral artery. And the continuation of internal carotid artery is the middle cerebral artery. Continuation of internal carotid kya hota hai? Middle cerebral artery. Fine. What are these two arteries? Vertebral arteries. This vertebral artery joins to form what? Basilar artery. And what are the terminal branches of basilar artery? Anyone? What is this? This is the posterior cerebral artery. ये क्या है? Vertebral. Can anyone tell me vertebral artery is a branch of what? Vertebral artery is a branch of? Yes, bacha. Vertebral artery is a branch of? बोलो बच्चों. Vertebral artery is a branch of first part of subclavian artery. You have to be very, very specific. It's a branch of first part of subclavian artery. Remember that vitamin C, D. First part of subclavian artery का branch है vertebral artery. There are two vertebral arteries. This vertebral artery joins to form the basilar artery, and this basilar artery lies in the sulcus in the pons. उसका नाम है basilar sulcus. You've seen the pons, no? In the college. So pons में there's a sulcus in between जिसका नाम है basilar sulcus. The basilar artery lies in the basilar sulcus of the pons. The basilar artery divides into terminal branches of posterior cerebral artery. Terminal branches are posterior cerebral. Basilar artery have got other branches also. This is a branch of internal carotid, bacha. What is this? And this is a branch of anterior cerebral. What is this branch? That's the posterior communicating artery, and that's the anterior communicating artery. Yes, very good. So posterior communicating artery is a branch of internal carotid. Anterior communicating artery is a branch of anterior cerebral. So we get, this is what we call a circle of Willis. A very, very important short note for you, circle of Willis. तो आपको ये draw करना है. You have to write about the circle of Willis, how it is formed, and what are the various branches of circle of Willis. एक होता है cortical branches, one is the central branches, and then where does the circle of Willis lie? That is something that you have to know. ये clear है? Tell me, which is an artery which does not take part in the formation of circle of Willis out of all these arteries? बोलो बच्चों, which is the artery which does not take part in the formation of circle of Willis? Yes, come on, come on, come on. Middle cerebral artery. Very good, very good, very good. Yes, the middle cerebral artery does not participate in the formation of circle of Willis. So circle of Willis is formed by, number one is the anterior communicating, second anterior cerebral, third is internal carotid, fourth is posterior communicating, and fifth is posterior cerebral artery. Both the sides. Fine, that's about the circle of Willis. And can anyone tell me now, see what I'm drawing for you? Bacha, diagram should be perfect, and draw diagram with colored pencils, that's fine. Now you tell me, what is this that I'm drawing? This is the what was I drawing? 8 minutes. Okay. Sorry. So this is the optic nerve, optic chiasma, optic tract. हाँ ठीक है बच्चा, ठीक है. Immature scalpel, labyrinthine artery and pontine artery. But can you tell me, there's an update. Labyrinthine artery is now said to be a branch of anterior inferior cerebellar artery. Okay, that's fine. So this is the optic nerve, optic chiasma, optic tract. ठीक है बच्चा, you tell me now what is this? ये अपना midbrain हो गया. That's the midbrain, that's the pons. See, जितना diagrams आप draw करोगे ना, the more diagrams you draw, the more your concepts are going to be clear. This is the medulla seen from the anterior aspect. That's the midbrain. What is this part of the midbrain known as crus cerebri? That's the pons here. In between is that sulcus, basilar sulcus. What lies here is the basilar artery. This is the medulla. You're looking from front. So what are these elevations in the medulla known as pyramids? What are these elevations in the medulla known as olives? Olives. And what is this elevation in the medulla known as the inferior cerebellar peduncle? Bacha, you have to be very clear about this. All this is asked in the viva. When that brainstem is given to you in the viva, they'll be asking you what is all this and how it is caused. So how the pyramids caused? By the crossing of corticospinal tracts. Ye pyramids hai do. What are these two? Olives. And how the olives formed? By the inferior olivary nucleus. And bacho, you remember this inferior olivary nucleus is the one which is sending fibers to the cerebellum, olivocerebellar fibers, and this is what constitutes to the climbing fibers of cerebellum. Climbing fibers in the cerebellum ke. This is olivocerebellar fibers which comes from the inferior olivary nucleus, and this inferior olivary nucleus forms an elevation here named olives. And what is the third elevation? That's the inferior cerebellar peduncle. Yeah, no, peduncles you have to know. Inferior cerebellar peduncle is the one which connects the medulla to the cerebellum. You have now middle cerebellar peduncle which connects the pons to the cerebellum, and the superior cerebellar peduncle connects the midbrain to the cerebellum. But so you have to know the tracks which are passing through the peduncles, the afferents and efferents. This is all asked in vivas, MCQs, short notes. Middle cerebellar peduncle, superior cerebellar peduncle, ये सब आना चाहिए. Okay, bachcho. Now you tell me, see, I'm just telling you what all things are important and what things you should know from the point of view of your exams. This is a quick revision that we're doing. Hey, hello, look how beautiful. My God, this is beautiful. Tell me, what is this view? Hey, what is this view? Kahan se dekh rahe ho? Where are we looking this from? This is the inferior surface of the brain, right? Inferior surface of the brain. And look, what have I drawn for you? What is this area known as? This is something that you get as a short note, bacha. So what is this area known as? This is what we call as the, any guesses? Interpeduncular fossa. Very good, very good. This is what we call as the interpeduncular fossa. Yes, very good. Interpeduncular fossa. Rhomboid fossa, fourth ventricle को भी rhomboid fossa बोलते हैं. So this is actually known as interpeduncular fossa. What are the boundaries, bacha? What are the boundaries of interpeduncular fossa? Anterolateral, you get this as a short note. Anterolateral is the optic tract. Posterolateral is the crus cerebri. The floor of the interpeduncular fossa is formed by, yes, bacho, tell me, what is this? Pituitary stalk. ये दो कौन है? Mammillary body. And what is this behind? That's posterior perforated substance, right? So that's the pituitary stalk or the infundibulum. These are the two mammillary bodies. That's a posterior perforated substance. ये हो गया floor of interpeduncular fossa. And what are the contents of interpeduncular fossa? Can anyone tell me what is this nerve? Bacho, what is this nerve? Which is attached to the midbrain, which arises from the ventral aspect of the midbrain. ये कौन है? This is a content of interpeduncular fossa. Yes, bacha. What is that nerve? Third nerve. That's the third nerve. That's a third nerve. And what lies here is the circle of Willis. Third nerve and the circle of Willis. Now, I'm not drawing that circle of Willis. So it will be that everything will go. So, contents of interpeduncular fossa kya hai? The third nerve and the circle of Willis. So, clear? Why have I told you this interpeduncular fossa? We are discussing the circle of Willis. So, you have to draw this interpeduncular fossa. You have to write the circle of Willis lies in the interpeduncular fossa. वैसे interpeduncular fossa itself can come as a short note for you. ठीक है बच्चों? Very good, very good. हाँ, चलो, very nice, very nice. इसको क्या बोलते हैं? What is this? This known as uncus of the temporal lobe, and hidden inside this uncus, deep to the incus, is a part of the temporal lobe which we call as the insula. Insula. I just told you that. Fine, clear. Very good. Very good. So the same thing it is. Okay. A short idea, a brief idea about the veins of the brain. Look, because veins, if you see in the books, it's very difficult, complicated to understand. Just remember what I'm telling you. So the veins of the brain are divided as superficial veins and deep veins. Superficial and deep veins. The superficial veins कौन से होते हैं? One is the superior cerebral vein. Just remember the superior cerebral vein. Second, inferior cerebral vein. What is anterior? Hi, good evening. Cerebral vein. The superior cerebral vein will be present on which surface? Supralateral surface. And this superior cerebral vein drains into this sinus. Bacha, what is this sinus? Superior sagittal sinus. Right? So superior cerebral veins drain the supralateral surface and they open into the superior sagittal sinus. The inferior cerebral vein drains the inferior surface of the brain, and this inferior cerebral veins will open into cavernous sinus. So one of the tributary of cavernous sinus kya hai bacha? Inferior cerebral vein. So the inferior cerebral vein opens in the cavernous sinus. They also open into the sigmoid sinus. Sigmoid sinus. Remember that. Next is the anterior cerebral vein. Anterior cerebral vein lies in the callosal sulcus. You remember callosal sulcus above the corpus callosum on the medial surface of the brain? उसके साथ आर्टरी होती है, anterior cerebral artery. So anterior cerebral artery and anterior cerebral vein, they line the callosal sulcus. And fourth is middle cerebral vein. See, I'm making it very easy for you. Middle cerebral vein is of two types. Superficial middle cerebral vein and deep middle cerebral vein. Superficial middle cerebral vein, deep middle cerebral vein. The superficial middle cerebral vein lies in the lateral sulcus. Medially, it communicates with the cavernous sinus. So, bacho, if you remember cavernous sinus, if you remember the tributaries of cavernous sinus, There's three sources of tributaries of the cavernous sinus. One is from the orbit, one is from the meninges, and the third one is from the brain. From the orbit क्या होता है? The superior ophthalmic vein, the inferior ophthalmic vein, the central vein of retina, tributaries of cavernous sinus from the orbit. From the meninges, tributary क्या था? Sphenoparietal sinus. And from the brain, there are two tributaries. एक है inferior cerebral vein and दूसरा is the superficial middle cerebral vein. Now just try to correlate everything. ठीक है? So the superficial middle cerebral vein medially communicates with the cavernous sinus. On the lateral side, it communicates with the superior sagittal and the transverse sinus. Fine? And what is left is the deep middle cerebral vein. ठीक है ना बच्चों? I'm just revising this. This is a quick revision. Okay, but this I'm trying to thoda sa explain because these things are always difficult. Okay, now you tell me, bachon. Now you tell me the anterior. Sorry. Now this anterior cerebral vein plus deep middle cerebral vein plus stride veins. Stride vein comes from the perforated substance. जो perforated substance है ना बच्चों, anterior and posterior perforated substance. From there the vein comes. They drain the deep nuclei. These are the stride veins. So the anterior cerebral vein, the deep middle cerebral vein, and the stride vein joins to form what is known as the basal vein. They join to form the basal vein of Rosenthal. Very good, Paridhi. Basal vein of Rosenthal. Yes. So this is a very important MCQ, bachcho. And here venous drainage is something which the students find it difficult. So just try to understand the way I'm telling you. That's it. So the anterior cerebral vein, the deep middle cerebral vein, and the stride veins, which comes from the perforated substance, they join to form the basal vein of Rosenthal. Right, now which are the deep veins? The deep veins are the sorry, what is happening here? The deep veins are the internal cerebral veins. Internal cerebral vein. Deep vein एक ही है, मतलब there are two internal cerebral veins. And how this internal cerebral vein formed? This internal cerebral veins are formed by joining of three veins. बस ये mnemonic, actually don't tell mnemonic, but just remember this TCS. T is thalamostride. Tata Consultancy Services, thalamostride. C is choroidal. एक choroid plexus को drain करेगा. It will drain the choroid plexus, choroidal. And S is septal. Septal vein drains the septum pellucidum. So thalamostride vein drains the caudate nucleus and thalamus. Thalamostride. Stride is caudate. So thalamus and caudate nucleus के बीच में एक vein होती है, thalamostride vein. Right? So thalamostride vein. The second is the choroidal vein which drains the choroid plexus. And the third one is the septal vein which drains the septum pellucidum. These three veins joins to form the internal cerebral vein. Two internal cerebral vein joins to form the two internal cerebral vein joins to form the great cerebral vein. Two internal cerebral vein joins to form the great cerebral vein of Gallen. Very good. So two internal. ठीक है ना बच्चा? How is the internal cerebral vein formed? By joining of three veins. Two internal cerebral vein joins to form the great cerebral vein of Gallen, and this great cerebral vein of Gallen drains into the great sinus. Great cerebral vein of Gallen drains into the straight sinus, and the basal vein drains into the great cerebral vein. The basal vein drains into the great cerebral vein of Gallen. Okay, great. Very good. You are all answering very well, Bacha. Very nice. Very good. Perfect. Perfect. In a short, ऐसे revise करो बच्चों. When you're going for your exams, the day prior to the exams, do not read the entire book. Just read the main points or try to recollect the main points. Like three veins: the superior cerebral, middle cerebral, inferior cerebral, anterior cerebral veins. ऐसे. So how is the basal vein formed? By the joining of anterior cerebral, the deep middle cerebral, and the stride veins. The basal vein drains into the great cerebral vein of Galen. The great cerebral vein of Galen is formed by the joining of two internal cerebral veins, and the two internal cerebral veins are formed by the joining of three veins: thalamus, right, choroidal, septal. Perfect. Okay, great. Very good. You can have a look at this slide. See, you can have a look at this slide. This will solve all your doubts. So, what is this now? This is the thalamus striate vein. ये क्या है बच्चा? This is the caudate nucleus, है ना? And what is this nucleus? That's the thalamus. This nucleus here is the thalamus. हाँ. सरफेस एनाटॉमी नहीं है बच्चा. सरफेस एक्चुअली दे आस्क सरफेस. हाँ, एनाटॉमी में ओके ठीक है. विल सी दैट. Fine. So this is caudate nucleus. This is the thalamus. What is this vein between the caudate nucleus and thalamus? Known as this is the thalamus striate vein. What is this? This is the choroid plexus. ये choroid plexus है. What is this number 2? I'll just put numbers here. This is number 1 here for you. This is number 2. ये 1 है. ये 2 है. That's the choroidal vein. And this is the septum pellucidum. So this is the septal vein. Together joins to form what are these veins? This is the internal cerebral vein. Internal cerebral vein. Two internal cerebral vein joins to form what is this? The great cerebral vein. And what is this going to be? Basal vein. ठीक है. So एक slide में everything comes there. Very good. चलो. Clear है बच्चों? Is this clear? Okay, look, I just make this. See if you can understand this. I make this slide. So this is thalamus striate, this is choroidal, this is septal vein. So this vein becomes the internal cerebral vein. This is another internal cerebral vein. Two internal cerebral vein joins to form the great cerebral vein. The great cerebral vein of Galen drains into straight sinus. And then what is this vein? Basal vein. That's it. That's the easiest way to understand the venous system of the brain, the venous drainage of the brain. बच्चे, you have to elaborate. हाँ, ये मतलब see, this is what is required. हाँ, इसको थोड़ा सा elaborate करना पड़ेगा. Venous drainage of brain, blood supply of brain में arterial supply, blood, venous drainage आता है. So this is for your understanding the diagram I have drawn. हाँ, yes, and then you have to write. थोड़ा सा explain करना है ना. If it's an LQ, at least 3 pages you have to write. With diagrams in between, proper diagram, neat label diagram. Even if you draw good diagrams, the examiner first looks at the diagram, and if you draw such a diagram which is self-informative, I as an examiner need not look what theory you have written. If you have drawn a beautiful diagram indicating all the labelings and ऐसे draw करोगे तो I know your concepts are clear. So the more diagrams that you draw in the paper, the better marks you get. ठीक है? Okay, great. Very good. And brain can just see all the soft parts for the practicals, revise all the soft parts. Everything is asked of neuroanatomy. That's a separate table of neuroanatomy. So be very clear. I'll start with this. Have a look at this. Chalo. Just have a look. What is this now? What is this structure that I'm drawing? This is what we call as the corpus callosum. Have a look. Corpus callosum. So corpus callosum is what type of fiber? Pehle examiner will ask you what is this. The moment you see this corpus callosum, the next question is what is the type of fiber? It is a commissural fiber. And what are commissural fibers? They connect similar areas in the opposite hemisphere. Similar areas in the opposite hemisphere. The largest commissural fiber is corpus callosum. Snehajit, commissural hai, projection nahi hai. Projection is internal capsule, bacha, phonics. Okay. What are the parts of corpus callosum? This is the rostrum, that's a genu, that's a trunk, and that's a splenium, right? Rostrum, genu, trunk, and splenium. Fine. Okay. This is what we call as anterior commissure. Anterior commissure. Jo bhi commissures aate, these are all commissural fibers. What is this now? Bacho, what is this? This is the fornix. This is the fornix. Let me come back to the fornix later. So that's the fornix. Now, what is this structure? What is this structure? Can anyone tell me what is this structure? ये क्या मैंने draw किया? What is this that I've drawn? The yellow colored structure. The yellow colored structure is a curtain between the corpus callosum and the fornix. Excellent. That is the septum pellucidum. Very good, very good, very good, bacha. Snehajit, very good. Immature scalpel, very good. Yes, Demon. Denon, very good. Shantanu. Yes, very nice. So you all are answering. So very good. So this is septum pellucidum, bacha. And if we break this septum pellucidum and we go on the lateral side, if we break this septum pellucidum and we go inside, we go in a very big cavity of the brain. What is this big cavity of the brain known as? Come on. Lateral ventricle. Very good. That's a lateral ventricle. So lateral to the septum pellucidum is the lateral ventricle. So what is the septum pellucidum and the fornix form for the lateral ventricle? The medial wall. Medial wall. So medial wall of lateral ventricle would be formed by the septum pellucidum and the fornix. Clear? That's a very important relation. Very good. Very good. Now coming down to this. This is what we call as the lamina terminalis. Lamina terminalis. Now what is this here? This is the optic chiasma. Just try to understand this optic chiasma. This is the infundibulum or the pituitary stalk. That's the pituitary gland. This is the mammillary body. Mammillary body. Now we come back. What is this going to be? One moment. This is the midbrain. That's the pons. That's the medulla. We come behind. What is this gland, bacho? That's a pineal gland. And as we come down, what's this going to be? Cerebellum. That's a cerebellum. So, bacho, if you remember this, see what is this from here? This and this. What is this area? What is this area? What is this area? Between the optic chiasma and the crus cerebra of the midbrain. Yeah, na, ye midbrain hai. Dekho, bacho, this is the midbrain. That's a pons. That's a medulla. This is the interpedunclar fossa. Very good, surgeon. This is, yahi hai na bacha, this is the interpedunclar fossa. We were looking like this. Yahan se dekh rahe the. We were looking from the base of the brain, and that was the interpedunclar fossa, jiske boundaries tha optic chiasma, piche is the crus cerebri, and this was forming the floor of the interpedunclar fossa. Clear? That was a view from the inferior side. This is a section that we have taken. This is a section that we have taken. So try to understand in all different ways. Fine, bacho. Now that's a pineal gland. Above the pineal gland, we have a commissure here. Below the pineal gland, we have a commissure here. What is this commissure? Anterior commissure. Exactly piche jate, we go straight back. What is this commissure? Posterior commissure. What is this commissure? This is what we call as the habenular commissure. Habenular commissure. That's a posterior commissure, and that's a pineal gland. Pineal gland together, what do you call this as? The habenular commissure, the pineal gland, and the posterior commissure together forms what? Can anyone tell me this? I'm looking at the screen. Bolo bacho. Epithalamus. Very good. This is what forms the epithalamus. Ye yaad rakhna bacha. This is what is known as the epithalamus. मतलब सी डायनकेफ्लॉन है ना, डायनसेफ्लॉन. एक मिनट, आई जस्ट टेल यू दिस, जस्ट हैव अ लुक. Diencephalon is made up of how many parts? One is the thalamus, the second one is the hypothalamus, the third is the epithalamus. Ab epithalamus is made up of three parts. One is the habenular commissure, pineal gland, and one is the posterior commissure. Ye ban gaya epithalamus. The next part of the diencephalon is metathalamus. Can anyone tell me what is metathalamus? What is the metathalamus made up of? Bacha, anyone? Metathalamus. Metathalamus is made up of the medial geniculate body and the lateral geniculate body. Medial and lateral geniculate bodies होते हैं ना. देखो midbrain है, midbrain. The dorsal aspect of the midbrain, there are 2 and 2 bodies like this. Dorsal aspect of the midbrain. What are these that I've drawn? Bolo bacha, what is this that I've drawn? And then you get something like this. This is the midbrain from behind. पीछे से देख रहे हो आप? So what is this? This is the superior colliculus. That's the inferior colliculus. Corpora quadrigemina. superior colliculus, inferior colliculus. This is the medial geniculate body and that's the lateral geniculate body. याद है ना बच्चा? Superior colliculus से the fibers go to the lateral geniculate bodies. हाँ, visual pathway. Superior colliculus से lateral geniculate body को जाते हैं and inferior colliculus से the fibers go to the medial geniculate body, auditory pathway. Right? So these are the geniculate bodies and this medial and lateral geniculate bodies constitutes to what? Metathalamus. ये याद रखिए बच्चों. And the last part of the dancephalon is known as what? The subthalamus. Just remember this. These are the parts of the dancephalon. Okay. These are the parts of dancephalon. Thalamus, hypothalamus, epithalamus, metathalamus and the subthalamus. And what is the cavity of the dancephalon known as? Anyone? What is the cavity of the dancephalon known as? Like telencephalon से क्या बनते हैं? Cerebral hemispheres. The cavity of telencephalon is lateral ventricle. Dancephalon, what is the cavity of the dancephalon? Third ventricle. Third ventricle. Yes, the cavity of dancephalon is third ventricle. And one more thing, bacha. This subthalamus जो है ना, subthalamus. Look, subthalamus is a part of dancephalon, right? The last part of the dancephalon below the thalamus is what we call as the subthalamus. So subthalamus is a part of the dancephalon, but this subthalamus is included in the basal ganglia. It is included in the basal ganglia. You know the parts of basal ganglia, bacha? It is the caudate nucleus and putamen, what we call as the striatum. Caudate nucleus and putamen, that's striatum. Second, globus pallidus. Third, substantia nigra. And the fourth is the subthalamic nucleus, right? Subthalamic nucleus. So subthalamic nucleus is a part of basal ganglia. Barabar hai? What are the parts of basal ganglia? Once again, caudate nucleus and putamen, together known as striatum. Second is globus pallidus. Third is substantia nigra. And fourth is the subthalamic nucleus. So subthalamic nucleus is a part of basal, I mean it belongs to the basal ganglia, but actually it's a part of dancephalon. बस ये याद रखना, ठीक है? Okay. Very good, very good. So now you tell me, we get a sulcus here, bacha. We get a sulcus here. What is the name of this sulcus? The name of this sulcus is what we call as the hypothalamic sulcus. This is what we call as the hypothalamic sulcus. This entire area is known as the dancephalon. This entire area is known as the dancephalon. This dancephalon is divided by the hypothalamic sulcus into what is this here? Thalamus. And what is this below here? Hypothalamus. Ye upar thalamus, below is the hypothalamus. Okay, now you tell me, bachcho. Fine. Okay, what is this number 4? Number 4 is the fourth ventricle. What is this? This is the central canal. And what is this? This is the aqueduct of Sylvius. Aqueduct of Sylvius, right? That's the aqueduct of Sylvius. So now you tell me, where is the third ventricle line? Okay, I'll just quickly tell you this. Look. Very good, very good. Very good. Look, now these are the two hemispheres. Ye thalamus hai, ye hypothalamus hai. Just quickly, I'll finish this. That's the thalamus and hypothalamus. What is this sulcus here? That's a hypothalamic sulcus. Ye upar thalamus, niche hypothalamus. For this side, that's the thalamus, that's the hypothalamus, that's the sulcus. Now, when we join these two hemispheres like this, no. They don't stick to each other. No. The thalamus and hypothalamus, there's a concavity like this. There's a concavity. That's the thalamus, that's the hypothalamus. There's a concavity here like this, and that's a sulcus. For this side, it is like this. This is the thalamus, that's the hypothalamus, that's the sulcus here. Now, when we join the two hemispheres like this, we get a cavity here, and this is the cavity of third ventricle, right? So how many third ventricles are there? There's only one third ventricle, right? And that's in the midline. Matlab, ye do hemispheres hai like this. These are the two cerebral hemispheres. When we are taking a sagittal section like this, when we are cutting the brain, we are taking a sagittal section like this. That means we are actually cutting through the third ventricle. We are actually cutting through the third ventricle. Matlab, this entire area that you're looking at, is nothing but the third ventricle itself. Right? This is the third ventricle itself, right? So now you tell me, what is the roof of third ventricle formed by? The roof of the third ventricle is formed by the fornix. So just that the roof is formed by the fornix. The floor is formed by optic chiasma, the pituitary stalk, the mammillary bodies. Wait, Ryu. Wait. What is the anterior wall formed by? Anterior wall is formed by the anterior commissure and the lamina terminalis. Anterior commissure and the lamina terminalis. The posterior wall is formed by the pineal gland, the posterior and the habenular commissure. And then where is the thalamus and hypothalamus, bacho? The thalamus and hypothalamus forms the lateral walls of the third ventricle. Like this example I always give, the room in which you are sitting, that's the cavity of third ventricle. You're right inside the third ventricle, right? You're watching this lecture. You're sitting inside the third ventricle. The upper corner roof, niche floor, anterior wall, behind is the posterior wall. And what are these two walls? Lateral walls. So the roof is formed by the fornix. The floor is formed by the optic chiasma, the pituitary stalk, the mammillary bodies. The anterior wall is formed by the anterior commissure and the lamina terminalis. Okay, the posterior wall is formed by the epithalamus, and the lateral walls are formed by the thalamus and hypothalamus. That's the third ventricle, a very, very important topic for the exams, third ventricle, right? And if we break this septum pellucidum, what is the cavity inside this? Lateral ventricle. And this lateral ventricle communicates with the third ventricle through a foramen here. Bolo bacho, what is this foramen? The lateral ventricle communicates with the third ventricle through a foramen here. That's the foramen of Munro. And the third ventricle communicates with the fourth ventricle through the aqueduct of Sylvius. Perfect. That's about the third ventricle. Very good. Clear to all of you? Look at this. Can anyone tell me what is this view? Kahan se dekh rahe ho? What are you looking this from? Where are you looking this slide from? This is a view from posterior side. Very good. So what is this number 1 that I've written? What is this number 1? Number 1 kya? Pineal gland. That's a pineal gland. So what is this? Superior colliculus. That's an inferior colliculus. Superior and inferior colliculus, right? What is this diamond shaped structure? You've removed the cerebellum. So what is this diamond shaped structure here? That's the fourth ventricle. Fourth ventricle, pad lo bacha. Fourth ventricle is a very important topic. Fourth ventricle is made up of two parts. The roof is formed by the cerebellum. The floor is formed by, half is formed by the pons here and half is formed by the medulla here. In the pons, what is this known as? Tell me, what is this structure known as? Bolo bacho. What is this rounded structure known as? Yes, Nejit, lower half of pons and upper half of medulla. Yes. What is this rounded structure known as, bacho? This is extremely important. You should know this, and this is always asked in the Viva. This is what we call as the facial colliculus. Pruthak Matre is not there. Answer karo, bacha. That's the facial colliculus. And how's the facial colliculus formed? The facial colliculus is formed by the fibers of facial nerve as they wind around the abducens nucleus. Right? Red nucleus nahi hai, bacha, ye. That's the, how is this facial colliculus formed? Look, ek minute, I'll just draw this for you. This is the sixth nerve, nucleus of sixth nerve, and this is the nucleus of seventh nerve. The fibers of seventh nerve, they wind around the sixth nerve and they get out like this. Yes. And when they wind here, they form an elevation outside, right? They form an elevation here. And this elevation is what we call as the facial colliculus. ये बहुत important है बच्चा. मतलब facial colliculus is formed by the fibers of which nerve? Facial nerve, remember. And which is the nucleus beneath the facial colliculus? Abducens nucleus. ये याद रखना. Fibers of which nerve form the facial colliculus? Facial nerve. And which is the nucleus beneath the facial colliculus? That's the abducens nucleus. So what is facial colliculus? The fibers of facial nerve, they form an elevation as they wind around the abducens nucleus. That's the facial colliculus. ये याद रखिए. अरे बच्चा, neuroanatomy is awesome. It's beautiful. You just have to understand it. right? Okay, now you tell me what is this? Number one, what is this triangle and what is this triangle? What is that triangular structure? Number one, anyone, number one is known as the hypoglossal triangle. Hypoglossal triangle. And number two is the vagal triangle. Bacha, everything is correlative. Kaisa hai na? Everything is correlative. You should just be able to correlate things. Anatomy is just easy if you are able to correlate. Like तो okay, चलो बच्चों, hypoglossal triangle is formed by what? अगर इसके नीचे जाओगे, if we go deep to this hypoglossal triangle, we get the hypoglossal nucleus there. And if we go deep to the vagal triangle, we get the dorsal nucleus of vagus. Dorsal nucleus of vagus. Okay. So just remember this hypoglossal and vagal triangle. Fourth ventricle is another very important topic. एक बार देख लो book से. I've just told you the important things. Now you tell me, बच्चों. Look at this. I'll draw a slide for you. Important topics पढ़ लो neuroanatomy के. Don't read everything. Not all things are important for you. That's a brainstem. This is the midbrain. That's a pons. That's a medulla. What is this in front? Pyramids here. What is this here? Olives. And what is this? That's the inferior cerebellar peduncle. What is this? That's the middle cerebellar peduncle. Okay. Area prostrema. Yes, yes. Yes, bacha. The details I'm not telling you. Yes, yes, you all can attend, Jangir. So this is pyramids, that's olives, and that's the inferior cerebellar peduncle. This is what we call as the crus cerebri or the cerebral peduncles. Now, this is a very important. देखो cranial nerves आते हैं ना बच्चों. Cranial nerves comes as a LQ for you. हाँ, उसमें से what you are supposed to read is seventh nerve. Seventh nerve is a must. Facial. Glossopharyngeal nerve. Glossopharyngeal ninth. And hypoglossal nerve. ये तीन nerves you have to know. You have to know. 7th, 9th and 12th. बाकी if you read 3rd, 4th, 6th, that is also good. But 7th, 9th and 10th is a must. So कोई भी cranial nerve, when you read the cranial nerves, the first thing is functional components. Functional components, what the cranial nerve is going to supply. So that is functional components, the first thing. Second thing is the name of the nuclei of the cranial nerve. So the cranial nerves have got different nuclei. So first thing is functional component. Second thing is the cranial nerve ka nucleus. Third thing is attachment to the brain stem. So you are going to draw this diagram of the brain stem and you are going to show the attachment of cranial nerves on the brain stem. Okay, so let us finish this. If you can tell me what is this nerve which is emerging from the ventral aspect of midbrain, and what is this nerve which is emerging from the dorsal aspect of the midbrain? मतलब there are two nerves जिसके nucleus are present in the midbrain. One nucleus is at the level of superior colliculus and one nucleus is at the level of inferior colliculus. बस ऐसे याद रखना. This is easy to understand. So what is this? That's the third nerve. And what is the only cranial nerve which emerges from the dorsal aspect? That's the fourth nerve. Yes. The only cranial nerve which emerges from the dorsal aspect is fourth nerve. So if I ask you, bacha, where is the nucleus of third nerve located? What do you say? Where is the nucleus of third nerve located? The nucleus of third nerve is located in the midbrain at the level of, ये ना sections आते हैं, हाँ, to draw on the exam, sections of the brainstem. So midbrain at the level of superior colliculus. And where is the nucleus of trochlear nerve located? It's in the midbrain at the level of inferior colliculus. Those sections of midbrain के, one at the level of superior, one at the level of inferior colliculus. At the level of superior colliculus, you also get a big nucleus जिसका नाम है red nucleus. Red nucleus. Fine. Now, what is this nerve? Can anyone tell me what is this nerve which is attached to the junction of pons with the middle cerebellar peduncle? At the junction of pons with the middle cerebellar peduncle, there's a nerve which is attached here. Uska nucleus is in the pons, huh, bacha? Nucleus is in the pons. But when the nerve comes out of the brainstem, it is attached at the junction of the pons and the middle cerebellar peduncle. What's that? That's the fifth nerve. That's a fifth nerve. So when you're writing a cranial nerve, the third point is attachment to the brain stem. So where is the nerve attached to the brainstem? Fifth nerve at the junction of pons with the middle cerebellar peduncle. Now what is this junction known as? ये pons है, ये medulla है. So what is this junction known as? Pontomedullary junction. At this pontomedullary junction, there are three nerves here. Can anyone tell me? That's the sixth nerve, that's the seventh nerve, that's the eighth nerve. Sixth, seventh, and eighth nerve. Just remember this, huh? सबसे medial कौन है? Sixth nerve. The sixth nerve is the most medial and the most lateral is the eighth nerve. Huh? This is extremely important. Huh? Bachcho, this comes as MCQs. This should be perfect. So the medialmost nerve attached to the pontomedullary junction is sixth. Lateralmost eighth. Perfect. Very good, bacha. Very good. What are these nerves between the olives and the inferior cerebellar peduncle? What is this nerve? Okay, nerves attached between the olives and the inferior cerebellar peduncle are ninth, 10th, and the cranial accessory. Ninth, 10th, and cranial accessory. They're attached at the junction of olives and the inferior cerebellar peduncle. And what is this nerve which is present between the pyramids and the olives? Pyramids and olives, what's this? 12th nerve. Between the pyramids and the olives is the 12th nerve. Clear, bacha? I'll just tell you one representative nerve, glossopharyngeal nerve bolunga aapko, huh? We'll see this later, huh? Okay, clear? So that's about the brainstem. ऐसे याद रखना. So third and fourth nerves are attached to the midbrain. Nerve attached at the junction of pons with the middle cerebellar peduncle is fifth nerve. Sixth, seventh, eighth at the pontomedullary junction. 9th, 10th, 11th between the olives and the inferior cerebellar peduncle. 12th is between the pyramids and the olives. Fourth point क्या होगा? Fourth point is exit through the foramen. Exit through the foramen. Can anyone tell me the third, the fourth, and the sixth nerves? Where are they going to? चलो बच्चों, I'll make it easy for you. Huh? The third, fourth, and sixth nerves को कहाँ जाना है? Where are they supposed to go? Where are they supposed to go? चलो बच्चों, बोलो fast. Huh? What is this that I've drawn? Yes, very good, Soham. Very nice, excellent, bacha. Very good, surgeon. Very good, Snehajit. Then on. Very good. So the third, fourth, and sixth nerves are supposed to go to the orbit. And from the skull, if you have to go to the orbit, there's only one way. That's a superior orbital fissure. So this is the superior orbital fissure, which is divided into three parts by the common tendinous ring. Right? So this third, fourth, and sixth nerves are present in the posterior cranial fossa. आपको पता है ना? Anterior, middle, and posterior cranial fossa. So brainstem is in the posterior cranial fossa. So all the cranial nerves are in the posterior cranial fossa. अब ये third, fourth, and sixth nerves have to go towards the superior orbital fissure. They have to go towards the orbit. So they have to pass through the middle cranial fossa. And when they are passing through the middle cranial fossa, they are related to. Come on, can anyone tell me this? They will be related to what? They will be related to what? See, bacha, this is something which you have to know. That's a superior orbital fissure. That's a petrous part of temporal bone. And I said diagrams draw karo, bacha. The more the diagrams you draw, the more clear your basics are going to. That's it. That's the clivus. That's the foramen magnum. Yes. Soham, I'm not asking that, Soham. What is this? ये क्या है बच्चा? What is this? What is this structure? Yes, very good. This is the cavernous sinus. अब समझ में आ रहा है? अपना brainstem कहाँ है? Where is our brainstem lying? The brainstem is lying on the clivus, है ना? This is going to be our brainstem. The brainstem is lying on the clivus. The brainstem is lying in the posterior cranial fossa. अब ये third, fourth, and sixth nerves are supposed to go to the orbit, so they will be passing like this, and they will be related to the cavernous sinus. That's how we get the relations of the cavernous sinus. So this becomes a course of the third, fourth, and sixth nerves, and then they pass to the superior orbital fissure, and then what they supply, that is what you have to write. Perfect. Very good, very good. तो है ना, ये भी slide draw करना आपको. See, there are plenty of drawings that you have to draw in a neuroanatomy question. The more diagrams you draw and sequence में draw करोगे. So you draw this brainstem, you write the attachment to the brainstem. I know. Then you draw this cranial cavity. You show the foramen. That's exit through the foramen, फिर उसका extracranial course आता है. Understanding बच्चों? Okay, excellent, very good, very good. I'll tell you one glossopharyngeal nerve. देखो, we'll discuss one glossopharyngeal nerve for you. Huh? I'll make it simple. एक representative nerve बोलता हूँ, and then you can write the facial and the hypoglossal nerve like that. So first you have to know what is the glossopharyngeal nerve supply. The moment you know what is the nerve supply, automatically you know the components, functional components. So Bacho, you just tell me what is the glossopharyngeal nerve going to supply. Yes, start. You tell me, I'll answer. Let it be an interactive session, Bacho, so you'll understand it better. What is the glossopharyngeal nerve supply? Bolo, Bacha. I'm waiting. Bacho, glossopharyngeal nerve supplies the stylopharyngeus. Very good. Glossopharyngeal nerve supplies the parotid gland. Excellent. Very good. एक और चीज है जो glossopharyngeal nerve supply करती है. What else is the glossopharyngeal nerve supply? Taste. हाँ, sensory. General and special sensations to the posterior 1/3 of the tongue and the pharynx. See, now you know what, see, up tak hai na, by now you know the nerve. What the nerve supplies, you know. Glossopharyngeal nerve supplies एक muscle of the third arch, stylopharyngeus. Glossopharyngeal nerve supplies the parotid gland. Glossopharyngeal nerve supplies the tongue. Very good, excellent. So now you tell me, what are the functional components? कैसे याद रखोगे देखो. What are the functional components of the glossopharyngeal nerve? 1. Glossopharyngeal nerve supplies the stylopharyngeus muscle, which is a muscle of the third pharyngeal arch. To supply the muscles of the arches, what is that functional component which the nerve should have in its nucleus? That's the special visceral efferent component. Special visceral efferent component. So special visceral efferent component क्या supply करता है? It supplies the muscles of pharyngeal arches. So all the nerves which belongs to the pharyngeal arches should have this component, special visceral efferent, right? So glossopharyngeal nerve is going to supply the stylopharyngeus. What is the name of the component? So pehla component hoga special visceral efferent component, and what is it going to supply? Supplies the stylopharyngeus muscle. Supplies the stylopharyngeus muscle, right? Very good, bacha. And if you can tell me the name of the nucleus of the glossopharyngeal nerve. अब stylopharyngeus को supply करने के लिए glossopharyngeal nerve has got a specific nucleus. Can anyone tell me what is the name of the nucleus of the glossopharyngeal nerve that is specifically meant to supply the stylopharyngeus muscle? Yes, bacha. Anyone? That's the nucleus ambiguous. My God, you're all superb. That's the nucleus ambiguous. That's the nucleus ambiguous. So second point that we are going to write is the name of the nucleus, right? So I'm writing it together so it is easy for you to understand. What else is the glossopharyngeal nerve supply? Glossopharyngeal nerve is going, yes, glossopharyngeal nucleus ambiguous is a common nucleus for 9th, 10th and 11th. Excellent, bacha, very good. Glossopharyngeal nerve supplies what? It supplies the parotid gland. Parotid gland. And to supply the gland, what component should the facial nerve have in its nucleus? If I am a cranial nerve and if I have to supply a gland, I should have this component. Name of the component is general visceral efferent. General visceral efferent. So what is the component for glossopharyngeal nerve to supply the parotid gland? General visceral efferent. To supply the gland, component is general visceral efferent. तो ये क्या supply करेगा? Parotid. मतलब general visceral efferent, बच्चा, general visceral efferent will be present in which nerves? The other nerves which are also going to supply the glands. The facial nerve, the vagus, right? So all this will have this component, general visceral efferent. जो भी gland को supply करेगा, they will have this. And what is the name of the nucleus of the glossopharyngeal nerve to supply the parotid gland? That's the inferior salivatory nucleus. Are you all able to follow, bachcho? Vishwajit, otic ganglion is something different, bacha. Ganglions are different. Nuclei are different. So what is the name of the glossopharyngeal nerve to supply the parotid gland? Nucleus ka naam? Inferior salivatory nucleus. Very good. And the glossopharyngeal nerve also carries sensations from the tongue. Yes, Sanket, very good. So glossopharyngeal nerve also carries sensations from the tongue. What is that component which is going to take sensations from the tongue? The name of the component is special visceral afferent. Special visceral afferent. Matlab, you know the tongue, and you know who's going to carry special sensations from the tongue? The 7th nerve, the 9th nerve, and the 10th nerve. And for the 7th, 9th, and 10th cranial nerve, there's a common nucleus, and that's the nucleus of practice solitarius. That's it. Special visceral afferent, and that's nucleus of tractus solitarius. Are you able to follow this? That's how it is. So this is the functional component. That's the function, and that's the name of the nucleus. The तीसरा would be its attachment to the brainstem. Then you have to write where the glossopharyngeal nerve is attached to the brainstem between the olives and the inferior cerebellar peduncle. Then you have to write the glossopharyngeal nerve emerges out through which foramen? Jugular foramen. How foramens should be on the tip of your tongue, bacha. It gets out through the jugular foramen. Then the moment it gets out through the jugular foramen, it's outside the skull. Then the glossopharyngeal nerve is going to pass between the superior and the middle constrictor muscles of the pharynx. So between the superior and the middle constrictor, what goes? The stylopharyngeus muscle and the glossopharyngeal nerve. That's how the glossopharyngeal nerve enters the pharynx, and the glossopharyngeal nerve then goes deep to the hyoglossus muscle and then goes to supply the tongue. So that's a process of the glossopharyngeal nerve that I've told you. ठीक है बच्चा, you have to remember the process for every answer that you're going to write. फिर इसको elaborate करना है अपने को, हाँ? So read it like this and understand it like this. Anatomy is just beautiful, and if you are able to understand like this, you will enjoy the next years that you're going to go into. Okay, when you go in the OT and all, when you actually see this, I mean, it's good. Cranial nerves are easy. ऐसे पढ़ो बच्चा. See, and ऐसा है ना, each and everything from the books is not needed. Some students try to read each and every sentence from the books. You're all students, and we know the limitations. So we do not expect everything from the students word to word, because it's a learning process. You have to keep on learning throughout your life. But basics आना चाहिए. Like glossopharyngeal nerve passes to which foramen, that you have to know. Attachment to the brainstem, that you have to know. Right? Okay, very good. Chalo, very nice, bacho, very nice. We'll come to this now, this topic. Horizontal asked in the exams. Can anyone tell me what is this? Number 1. What is this number 1? What is this number 2? What is this number 3? This section is always kept in the exams. Neuroanatomy has to be perfect, bacha. There's a separate table for neuroanatomy. Right? So what is this number 1? Number 1 is the caudate nucleus, right? Caudate nucleus. Number 2 is the thalamus. So caudate nucleus, thalamus, and what is this? This is the lentiform nucleus. Between them, we get a V-shaped structure here, and this is the internal capsule. Internal capsule. What is the type of fibers, bacho? It's a projection fiber. Projection fiber, internal capsule. What do we call this as? Anterior limb. That's the genu. That's a posterior limb. So anterior limb lies between what and what? It lies between the caudate nucleus and the lentiform nucleus. The genu is a bend. The posterior limb lies between the thalamus and the lentiform nucleus. What is this part? इसको क्या बोलते हैं बच्चों? This is the retrolentiform part. Retrolentiform part lies behind the lentiform nucleus. The retrolentiform part is going to the occipital lobe. So bacho, what fibers is it going to carry? The retrolentiform part is going to carry which fibers? That's the easiest way to understand this. Anyone? Forceps major, bacha. Forceps major corpus callosum का part है वो. Corpus callosum. Forceps major and minor. Denon. अरे बच्चा, denon. Occipital lobe is concerned with what? Occipital lobe. Auditory नहीं है बच्चा. Auditory नहीं है. Occipital lobe is concerned with vision. Remember it like this. Occipital lobe is concerned with vision. So which pathway would be present in the retrolentiform part? Visual pathway. And a visual pathway, right? And there's one more part of the internal capsule which goes below the lentiform nucleus. It will go below the lentiform. The moment it goes below the lentiform nucleus, it goes in the temporal lobe. And temporal lobe contains which areas? Auditory areas, right? So what pathway are they going to carry? Auditory pathway. Now these two MCQs are extremely important. Visual pathway passes to which limb of the internal capsule? Your answer is retrolentiform part. And auditory pathway passes to which limb of the internal capsule? Your answer is going to be the sublentiform part. Very good, very good. बाकी है ना एक बहुत I mean, there's a MCQ which is always asked. The corticonuclear fibers pass through which limb? Can anyone answer this? The corticonuclear fibers pass through which limb? Yes? Corticonuclear fibers pass through which limb of the internal capsule? And the corticospinal fibers pass through which limb? Yes, bachcho. Corticonuclear, corticospinal. This you should know. This you should know. Corticonuclear will pass to the genu. ये याद रखना. Genu से corticonuclear fiber passes and posterior limb. What passes is corticospinal fibers. Huh? This 4 MCQs you should know. Corticonuclear, genu, corticospinal, posterior limb, retrolentiform part, visual pathway, sublentiform part, auditory pathway. Which is the main artery supplying the internal capsule? Middle cerebral artery. Middle cerebral artery. Okay. Okay, I'll just tell you one thing. Cerebellum. See if you can tell me this. The fibers to the cerebellum. See in one small I'll tell you the cerebellum. हाँ बस ये याद रखना है आपको cerebellum. What we call as the cerebellar circuit of the cerebellum. So what are the fibers which come to the cerebellum? We group these fibers into 2 types. One is what we call as climbing fiber and one is called as mossy fiber. Climbing fibers arise from inferior olivary nucleus. Climbing fibers arise from inferior olivary nucleus. This is what I've told you. Mossy fibers arise from spinal cord, vestibular nucleus and cortex. Okay, so these are climbing fibers and mossy fibers. So climbing fibers arise from inferior olivary nucleus and mossy fibers arise from here. Climbing fiber is going to stimulate what? Stimulate the Purkinje cell. You must be knowing this from physio. Climbing fiber stimulates the Purkinje cell. Mossy fibers are going to stimulate what? Granule cell. The granule cell is further going to stimulate Purkinje cell. Finally, who's going to be stimulated? Purkinje cell. When the climbing fiber directly stimulates the Purkinje cell, the mossy fibers, they first stimulate the granule cell, which further stimulates the Purkinje cell. Now, once this Purkinje cell is stimulated, what is it going to do? The Purkinje cell is the only motor output from the cerebellum. Take this from me. That's a very important MCQ. The only motor output from the cerebellum is Purkinje cell. Remember this. So that's the only motor output from the cerebellum, and it inhibits deep cerebellar nucleus. It inhibits the deep cerebellar nucleus and lateral vestibular nucleus. बस ये याद रखो. This is extremely important. So what is it going to inhibit? The deep cerebellar nucleus. And which are the deep cerebellar nucleus? The 4 nucleus. Nucleus globus, nucleus emboliformis, nucleus fastigi and nucleus globose. Those 4 nucleus of the cerebellum are the deep nuclei. So the Purkinje cell are going to inhibit the deep nuclei of the cerebellum and the lateral vestibular nucleus. Okay, so that's about the circuit of the cerebellum. Then you remember the connections, the superior, middle and inferior cerebellar peduncles, and what are the fibers which are passing through this peduncles. That's something very important. Okay. This is fine. What should I tell you? What else should I tell you? Okay. This is done. See, as far as neuroanatomy is concerned, functional areas is important. Blood supply is important. I'll tell you something here. Chalo bacha, you can tell me what is this section from? Chalo bacha, tell me. This section kahan se hai? What is this section of? See, sections are very important, and lesions of brainstems are very important. Lesions. ये बोल सकते हो what is this section taken from? What do you think is this? This is a part of brainstem. मतलब it would be either midbrain, pons or medulla. हाँ परिधि. Why is this midbrain? What is this? This is what we call as that's midbrain. And this is section of the midbrain at the level of what? Superior colliculus है या inferior colliculus है? This is midbrain, fine. This is at what? At what colliculus is this? Paridhi, why inferior colliculus? Why you saying inferior colliculus? Justify karo bacha. If you make a mistake here, that's fine. You should learn from your mistakes. See na bacha, what did I tell you? There's only one cranial nerve which, had this been inferior colliculus, no, then the nerve would be coming like this. The nerve would be coming like this. समझ में आया ये? Now clear what mistake you've done. This is a section of the midbrain at the level of superior colliculus. Why? Because the nerve is emerging from the ventral aspect. This is the third nerve. ये third nerve है बच्चा. That's the third nerve. Right? If this would have been inferior colliculus, then the fourth nerve would come from the dorsal aspect. ये देखो ना, the only nerve which comes from the dorsal aspect is fourth nerve, and that's how you're going to understand the section. But if you are seeing a section of the midbrain and the nerve is coming from the dorsal aspect, that means this is section at the level of inferior colliculus, and the nerve is trochlear nerve. We are seeing this nerve, so this is the section of the midbrain at the level of superior colliculus, and this is the third nerve. So this is a lesion, but this is a lesion. What is this? ये क्या है? What is this? This is substantia nigra. Red nucleus दिखाया नहीं है इसमें बच्चा. Red nucleus they have not drawn. They have not. This is not a section to understand the TS of the midbrain. This is a diagram to understand something else. That is why entire thing is not shown. This is a lesion of the midbrain. Lesion है ये, जिसमें what is this known as crus cerebri. So what is involved is the crus cerebri, and the third nerve is involved. Crus cerebri is involved and third nerve is involved, and substantia nigra is also involved. So this is a lesion. ये देख रहे हो आप? This is a lesion of the midbrain in which the crus cerebri is involved, the third nerve is involved, as well as substantia nigra is involved. अभी बोलो बच्चों, what passes through the crus cerebri? The corticospinal tracts. The moment corticospinal tracts are involved, the person is going to get a hemiplegia. And hemiplegia is of the opposite side. So what do we call this as? A contralateral hemiplegia. Brainstem का कोई भी lesion है ना, the hemiplegia is going to be on the opposite side. Remember, so because the crus cerebri are involved, we are going to get a contralateral hemiplegia. Because corticospinal fibers cross in the medulla, right? So this is corticospinal tracts involvement. So contralateral hemiplegia. Third nerve ka involvement hai. So third nerve, what does it supply? Third nerve supplies all the extraocular muscles except the lateral rectus and superior oblique. So all the extraocular muscles are paralyzed except lateral rectus. So lateral rectus is powerful, and the lateral rectus will pull the eyeball laterally. The person is going to look on that side. What is this? Lateral squint. So when the third nerve is involved, what lesion are we going to get? The person will come to you with a lateral squint. Because the superior oblique is involved, superior oblique is spared, superior oblique turns the eyeball downwards. तो वो diplopia दिखता है, double vision, diplopia. So because the third nerve is involved, we get a lateral squint plus diplopia. ठीक है ना? Lateral squint is because of sixth lateral rectus intact है, इसीलिए lateral squint. Because the lateral rectus is intact, we get a lateral squint. Because the superior oblique is intact, we get diplopia. The third nerve also supplies the levator palpebrae superioris. And because the levator palpebrae superioris is involved, the eyelid droops down. The eyelid droops down. What is that known as? Ptosis. That is known as ptosis. Because of the involvement of levator palpebrae superioris. And the third nerve also supplies the sphincter pupillae and ciliaris. Because the sphincter pupillae and ciliaris is involved, the pupils are dilated and fixed. Dilated and fixed. My dear children, this is extremely important short note for you. And this is what we call as the Weber's syndrome. Very good. Someone had identified it. Weber's syndrome. So Weber's syndrome is a short note. You have to draw the slide. Weber's syndrome is caused due to thrombosis of the posterior cerebral artery. The structures involved are the crus cerebri and the third nerve. Important structures. तो क्रस सेरेब्रा इन्वॉल्व होता है तो कॉन्ट्रालैटरल हेमिप्लीजिया हो गया. थर्ड नर्व इन्वॉल्व होता है सो अ लैटरल स्क्विंट, डिप्लोपिया, टोसिस एंड द pupils are dilated and fixed. Perfect. That's Weber's syndrome. हाँ बच्चा, nearly second to sixth all the prof exams are starting. Second to sixth. Okay, वैसे see what is this section taken from? Can anyone tell me section is taken from where? You can see this section. What is this section taken from? What is this section taken from? If you identify this, no, you'll be able to identify the section. Yes, a purse-like appearance of the purse-like appearance. Which nucleus is that? Purse-like appearance. Huh? Pons नहीं है बच्चा, ये pons नहीं है. And this is the medulla. That's the inferior olivary nucleus. Inferior olivary nucleus. That's medulla. Bachcha, that's medulla. Okay, what is this? This is the hypoglossal nucleus. Hypoglossal nucleus. These are the corticospinal tracts. And ye jo hai na, this is what we call as the medial lemniscus. Medial lemniscus. So what is involved here? See what is involved? Hypoglossal nucleus is involved. The medial lemniscus is involved. Medial lemniscus, what does it carry? Fine sensations. And corticospinal tracts are involved. So bacha, corticospinal tracts involved hota hai. So we get contralateral hemiplegia. Hemiplegia. Medial lemniscus is involved. So what happens? Contralateral loss of fine sensation. Fine sensation lost on the opposite side. Contralateral loss of fine sensation. Right. What else? 12th nerve is damaged. Chalo bolo. What is the 12th nerve supply? Bacha? 12th nerve supplies the tongue. 12th nerve supplies the tongue. So there is paralysis of the tongue. There's deviation of the tongue on the same side. Ipsilateral paralysis of the tongue. What is this known as? What is this known as? This is what we call as the medial medullary syndrome. This is what we call as a medial medullary syndrome. Right? Just remember this involvement of medulla. What is involved? This is due to thrombosis of vertebral artery, involvement of hypoglossal nucleus, medial lemniscus, and the corticospinal tracts. Corticospinal tracts are involved, so contralateral hemiplegia, medial lemniscus, so contralateral loss of fine sensations, and tongue is paralyzed, so paralysis of tongue on the same side. Hypoglossal nucleus is involved. The tongue is paralyzed on one side, say right side, body is paralyzed on the left side, fine sensations are gone on the left side. So this is what we call as a medial medullary syndrome. And there's one more syndrome in which the lateral aspect of the medulla is involved. Ye dekhiye. The lateral aspect of medulla is involved, and that is what we call as the lateral medullary syndrome or Wallenberg syndrome. Wallenberg syndrome is due to thrombosis of pica, posterior inferior cerebellar artery. Oh, just go through it. So I've told you two important syndromes here. Fine, bacho. I hope I've tried to do my level best to explain you this topic of neuroanatomy, but it's very nice. It's just read the things, and if you have any doubts, get back to me. Okay. Thank you, bacho. Thank you. Thank you to all of you for patient listening. Thank you so much. Bye. Log into this PW Med and explore the FARRE. Thank you to all of you.